Dr. Huebner, I am here with Mela, and Mela is here for a hair transplant surgery for traction alopecia. She's very excited and nervous, as everybody.
Yeah.
So, Mela, tell us about when you started losing your hair. Tell us how it affects you and why you're here.
Okay, so pretty much, I didn't actually realize that I was losing my hair until my dad made mention of it. Now, September 11th is significant because that is actually the day where I was in the military and I found out that there was a possibility I was going to war. And I think that's probably when I started losing my hair. And I didn't really notice because when I came back from Iraq, I went to an African hair braider to get my hair done. And at that point, I was 19. And she was like, what's going on with your hair? And because I became accustomed to it, I didn't even realize that my hair was balding all around the back and the sides. And I think it may have been from my kevlar, from wearing, again, tight styles back when I was in the military. And I think over the years it progressed and I didn't really notice because there were times where it would grow back in. I used Minoxidil. I used a whole bunch of different growth aid products in order to help it to grow. But it just got to a point where I was tired of constantly having to use drops, constantly having to use topical fibers in order to fill it in. And like I told the doctor earlier, I have a naturally high forehead, so I kind of became used to it. And in my culture, forehead is a good thing. To some people it's like, oh, you have a big forehead, but to me,
It's you.
It's me.
Yeah,
Hey,
yeah.
forehead. That's just what it is. So
Okay.
I just really want to make a change.
Okay, perfect. I'm going to highlight and again, I put some photos in there so people can really see.
Okay.
So, and she hides this so well, by the way, so I know this is hard for her to kind of show off. Normally, she's hiding this, but you can see the extent of her hair loss. Her hairline's gone back. You can see on the sides here, there's a couple fingers of loss. So, well, first of all, thank you for your service and going to Iraq in areas that I can't even imagine, especially during that time. And I cannot wait to get your hairline back. We're going to design your hairline now, talk about it, and we'll follow you throughout the day. And thanks again for, pushing this forward and letting other people see your journey.
No problem. Thank you.
Thank you, Mela. Okay, Dr. Huebner, I'm here with Mela. Mela has just finished her surgery, and I know that she, had a nice day today. She just finished eating some pizza for lunch. So overall, and don't hold back, tell us exactly how your day went.
Trust and believe I'm not going to hold back. So, well, first off, I'll start with the ending. I just had lunch. It was delicious.
Uh-huh.
I had a veggie slice of pizza. And, okay, so the anesthesia. See, I'm a person, I'm not really good with pain. That was honestly the worst part of the entire procedure. With the, needles being inserted into my scalp, that probably was the worst part. After that, my head literally felt like a cement block. I could not feel a thing.
In a good way,
in a good way. Meaning, it was so hard, I couldn't feel anything.
Mm-hmm.
So I was able to watch a few movies on Netflix.
Mm-hmm.
I fell asleep through it, which I was happy because my whole thing is I just wanted to get the procedure done and just wake up, not knowing what actually happened. But, watch TV. The young ladies were great. We had a few laughs here and there in between.
Mm-hmm.
But honestly, the procedure went well, in my opinion. Dr. Huebner talked me through, the areas of my scalp and you know, he was able to pack it all. From what I'm seeing, looks like he was able to pack everything all
Yes,
in.
let me just zoom up there
Yep.
so you can see her new hairline, or old hairline, I guess you could say. So I'm going to pan around. You can see that cool temporal curve all the way back. Now we got she had incredible donor. You can see how coarse and thick her hair is. But look how far we got back. You should easily be able to grow that all out, all the way around this side. Back on this side. I cannot wait. Talk about a game changer. This is going to be a huge game changer for you.
I'm excited.
Awesome. Well, thank you for showing your day, and more importantly, thank you for hopefully showing us your progress. I cannot wait till this starts to grow in. If you have any questions, please give us a call here, and we'll go over the post-op instructions now. Okay. Yep.
Thank
See you later. Yep. Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.